Thank you, Peg, for that kind introduction. And actually, Hudson's great-grandfather was a firefighter. So if he does go on to become a firefighter, he would be a fourth-generation firefighter. So we'll see. I do want to thank 2020 Vision for having us as far as the Phoenix Society. And as Peg said, maybe giving you a face to a fire. Someone that has experienced it. I've lived it for 50-some odd years now. And I think at the very, very beginning, Chief Gaines made the comment that a burn injury lives with you for your entire life. It's lifelong. The physical, the psychosocial, it never goes away. So when he mentioned that, and I have a very dear friend that's a nurse manager of a burn unit up in San Jose, and Jill always says, it's a lifelong injury, it doesn't go away. I want to just, for those of you that don't know about the Phoenix Society, just briefly, I didn't do a slide presentation per se. First of all, because I don't generally show graphic pictures of myself, just because I think we've all seen plenty of graphic pictures. I don't think there's any need for that. I think you all know what a burn injury looks like. But I just want to tell you, the Phoenix Society is basically the leading national nonprofit organization for burn survivors. And they are dedicated to empowering anyone that's been affected through a burn injury. And that includes not just the survivor themselves, but the family members, significant others, friends, and through support, education, and advocacy. And for 30 years, the Society has partnered with survivors, families, healthcare professionals, burn centers, the fire industry, to support recovery, improve the quality of burn care, and prevent burn injury. It's very important to us that we collaborate with all of you as far as the prevention efforts. So I just wanted to kind of give you a little bit of that background. As Peg said, I'm the former nurse manager of the burn unit in San Diego, at UC San Diego. But right now I do want to take you back a few years to 1959, April 29th. For those of you that are from Arizona, and I know there's a few of you here, I lived in a little tiny town called Gila Bend, Arizona, which there's nothing there now, and there was nothing there then. So I'm not really sure why we lived there, but we did. At any event, in the middle of the night, I heard a hissing sound, and I went to my parents' room and I said, I hear something, and they told me, it's just one of the farm animals. We were very rural. Go back and get in bed. What I actually was hearing was a gas leak, a hissing from the propane, which resulted in a water heater explosion, totally demolishing the entire home, burning it to the ground, and displacing my family. At the time, I was an only child. My mother was pregnant with my second sister at the time, and I sustained an 85% burn in 1959 before there were burn units. I was a little stubborn as a child. And still am, I guess. Thank you, Tony. I continued to spend basically every Christmas and every summer in the hospital getting reconstruction work done. And I guess it was just a natural progression to continue to stay in the hospital, so I became a nurse because it just felt very natural. I felt like I probably knew quite a bit at 18 about what the nurses were doing. Did I realize I was actually going to go into burn nursing at the time? Probably not. I wasn't sure that that was where I could work. Could I walk back into a burn unit and take care of people knowing what I personally had been through? So I originally started out in the emergency room, and a very good friend of mine that was a burn unit nurse at St. Mary's in Tucson, which there no longer is a burn unit in Tucson, but he came down and he said, you need to come up to the burn unit. Just come into the burn unit, let's talk, you need to just see. Well, I went in, I was sold. And I transferred initially as a burn tech before I was an RN, went to school, continued to work in the burn unit in St. Mary's, and loved every minute of it. It was very, very fulfilling. It was while I was working in the burn unit in 1981 that I saw an article about the Phoenix Society. And the article was about Alan Breslow, who was the founder in 1977 of the Phoenix Society. He had been in an airplane crash in, I believe, 1963, and had a vision that survivors needed other people to talk to. And that's what he did. He went and visited somebody else that had sustained a burn injury, and hence the beginning of the Phoenix Society. The Phoenix Society has grown in leaps and bounds. In the last probably 15 years, Amy Acton, who is also a former nurse manager of a burn unit, can't get rid of us, we'll just stay around some way or another. She is now the executive director, and she is also a burn survivor, has taken this organization to places that we just probably never really envisioned that we could go. And we have gone far. Our collaborations include the NFPA, Common Voices, the National Fallen Firefighter Foundation, the American Burn Association, the Congressional Fire Service Institute, the International Association of Fire Chiefs, the International Code Council, partnerships between survivor advocates, the fire service, prevention agencies, and so on. So when everybody, like Kathy just mentioned, connections, that's what we want to be about. We want to connect with all of you to work together. In 1995, I actually did step away from burn unit nursing, and I was given the honor of being a project manager on an EMSC grant that the University of Arizona was the principal investigator, with Tucson Fire Department also being an investigator. Part of that grant included prevention. And that's when I kind of got hooked on prevention and thought, wow, wouldn't it be great if we never had another burn camp? If we never had another adult retreat? If we never had another young adult summit? If we never had another admission to the burn unit? It's something that is a dream for me to think that all of the work that you do in here, if you impact just one life, the difference that you've made is immense. It's huge. One life. I'm not talking thousands, because I know our numbers in comparison to other injuries or diseases are small, but if you can just, from your prevention efforts, stop one person from sustaining a burn injury, you have accomplished a huge task. Just in the last couple days, with the loss of 2 Boston firefighters, the Phoenix Society has been able to extend their assistance. We have a program which is called SOAR, Survivors Offering Assistance to Recovery. And that program is an 8-hour training where family members and burn survivors, fire service, go through this training. They then are able to go and lend support to other family members, to the patient themselves, to the fire service. And we have 40 trained firefighters that have gone through the SOAR training. And there was a group of them, because our American Burn Association meeting is going on right now in Boston. We were able to send a group of our SOAR-trained firefighters to, assist in the devastation that's going on in Boston right now. And I think that says a lot for our organization and the firefighters as far as the service that they're willing to do above and beyond just what their normal job duty is, because the SOAR is strictly voluntary. We also have an advocacy training program, and this is where I really hope that you will think about, as I said, putting a face to fire. And on our website, there is a portion or a tab that you can tap on, and it's Faces of Fire. And it's people that have been through burn injuries and house fires or car accidents, and they've also all gone through an 8-hour advocacy training where we go and we speak. We'll partner up with the fire service. We'll partner up with any agency that needs us to speak out. I know burns aren't easy to look at, but you can't argue with a burn survivor about prevention. You just can't do it. So people are being trained on it. Every year at World Burn Congress, we train more advocates so that we have people that can partner with you They're in your community. All you have to do is call the Phoenix Society. They can let you know who's available in your area that's been through the training. They also go through like a speakers training so that they're also part of the Speakers Bureau. And that, again, is a very impactful way to get your message across. When we talk about messaging and prevention, we definitely need to hit a home run with this. I mean, there's no doubt in my mind, we need to keep working. But I want you to think about messaging from other agencies, such as the Cancer Society, Spinal Cord Injury, the AIDS Foundation, Arthritis Foundation, amputees. Can anybody tell me maybe what they see in their prevention messages that possibly we don't see in a lot of the fire prevention? Anybody?
Survivors.
Survivors. You look at any message from those organizations and agencies, and you will see survivors. And again, I know burns aren't always really attractive to look at, but we've got to include the burn survivors to get this message across. It's imperative. I will tell you that, you know, growing up as a child, it wasn't easy. And I will say I'm grateful that we have camps, because it certainly lends us the opportunity to teach children with our social skills training, which we also have through the Phoenix Society. We now have online training where people can get on, because there's a lot of people in rural communities that don't have access to support groups, don't have the ability to attend our World Burn Congress, which if any of you have the opportunity, it's in Anaheim this year in October, and it will change your life. It's a conference that initially started out intended for survivors and their family members, but has grown as far as including healthcare professionals, the fire service, all the prevention agencies. And I think, how many of this room have been to World Burn? I know there's several of you. Yeah. Talk to anybody that's been to it, and they'll tell you that it will change your life. I had the honor in 2003 of reconnecting with the surgeon that saved my life. It was very ironic. I actually had been at an ABA meeting, and the medical director that I had worked with had passed away. And before I left for the meeting, I was hearing a lot from family members and patients how devastating it was, and they didn't get to thank him for what he had done. And so I thought, wow, I've never really thought about trying to contact this man. And I thought, well, I am a little old, and it has been a few years, and I don't even know if he's still alive. And at the time, my mom was still living, and I asked her, do you think Dr. Peterson is still alive? And she said, I don't know. And so I picked up the phone. At that time, I still had home phones in '03. And I called information and got the phone number for the American Medical Association, called there, asked them if they had a Rex Peterson. And she told me yes, but he was retired. And I said, kind of sheepishly, do you know if he's still alive? Kind of a hard question to ask. And she said, oh yes, I can tell you the city he lives in, but I can't tell you anything else. So she told me he lived in Cerritos, New Mexico. So I then hung up, picked up the phone, called information for Cerritos, New Mexico, and asked if they had a Rexford Peterson listed, and they did. And I dialed the phone, and of course my heart was just pounding out of my chest. And this man answered the phone, and he said, may I help you? And I said, well, yes, I'm looking for a Dr. Rex Peterson. And he said, this is Rex. And I said, well, and of course I was very nervous. I don't want to bother you, but I don't know if you'll remember me, which was really probably a pretty silly thing to say. But in 1959, I was a 6-year-old little girl that lived in Arizona, and you took care of me, and I was burned over 85% of my body. And I said, my name is Cindy, and before I could say my last name, he said. And I just, like, my heart just stood still. And I thought, wow, there is a man that could tell me so many things about what happened. So I immediately imposed myself and said, I would love to meet you. And he said, oh, I would love to meet you, and where do you live? And I said, well, I live in San Diego. And he said, well, I'm in New Mexico, but I may be coming to San Diego. Well, unfortunately, he didn't. That was April that I called him. September, he was supposed to come. He didn't come. And I decided at that point I wasn't waiting, because I knew that he was in his late 70s at that time. Still very young, but still, I thought, I'm not going to wait. So I got on a plane with my 2 daughters with an invitation from him and his wife to please stay with them. And we went and we stayed. And needless to say, it was very emotional. From the moment he walked out the door and I got out of the car, we both started crying. He was a very large man, which I clearly remembered. He was about 6'3", and I just had, clearly a recollection. He had my medical records. They were all leather bound, because what I didn't know was he was a plastic surgery resident. So I was his board case presentation. So he had all of my records, and it was great. It was in this leather bound book, but he wouldn't give me the book, but he had made me a copy. He said, I just can't part with this, that you may have a copy of it. So I sat and I read through, and I was just, of course, being a nurse, I just was taken back. I mean, in 1959, first of all, he was criticized horribly for keeping this child alive. He hadn't documented that, but he had told me that, that other physicians were saying, what are you doing? But in his discharge summary, which I took to task with him the next morning after looking through my medical records, his discharge summary said, this child will be permanently, physically, and psychologically disabled. And I said, Dr. Peterson, I have a bone to pick with you. I said, your discharge summary concludes, and he said, oh my God, Cindy, I am so sorry. I never in a million years would have dreamed that you would go on to do what you've done. And he just profusely, and he said, I'd like to go back and erase it if I could. And I said, well, you can't, but it's there. And I said, but it makes me really proud to realize that that's what you thought, but I had an incredibly supportive family that stood behind me all the way. He was a pioneer. He definitely was a pioneer. He told me, though, that he had a couple things that he wanted to point out to me. Even though he was no longer working in burns, he still felt that there were several things that we needed to accomplish. He said one is pain management. Still not under control for burn patients. He said, we can snow them, we can put them in comas, but it's still not really under control. He said, so you need to work on that. Make a little jump right on that one. And then his second comment was prevention. He said, we're not where we need to be with prevention. If people are still getting burned the way that you did, we haven't completely done our job. He said, so that is something that's really important. And I hope you're continuing to work on that, which I was able to tell him I was. I feel like I am a woman that has had a very successful career for over 35 years. My proudest moments have probably been becoming a mom and becoming a grandmom to Hudson. But I do find a little bit of irony in the fact that he is the son of a firefighter. Kind of funny. So that's one of the silver linings to my burn injury, is that I have a son, I got involved as a nurse, got involved with the fire service. My daughter met a firefighter, and hence I have a grandson from the fire service. And that to me is something to be very proud of.